House Calls, sponsored by Roper St. Francis Healthcare.
Every year, more than half of the strokes in America occur in women. Dr. Alison Smock says many women don't acknowledge the symptoms because they don't know they're at risk.
In particular, patients with other stroke risk factors like high blood pressure and diabetes and high cholesterol who are also taking hormone replacement that may increase their risk for stroke. Stroke symptoms that you should be aware of are things like weakness on one side of the body, numbness and tingling on one side of the body, sudden onset vision difficulties, double vision, loss of speech, difficulty with coordination. The absolute most important thing to do is call 911. If something doesn't feel right, women are very in tune with their body. Go to the emergency department and let us sort it out for you. Don't wait. It is the third leading cause of death in women, so it's something that is very prevalent and needs to be addressed.
To learn more, call 843-402-CARE or visit rsfh.com.